Here's what your vote is going to get us with the $880 billion cut to Medicaid. And you can claim that there's no cuts to Medicaid all you want, but the budget proposal called for $880 billion in cuts from the Energy and Commerce Committee. And you cannot get those cuts out of the programs that committee oversees without cutting Medicaid. Basically, cutting Medicaid is going to decimate our healthcare system. Right now, it provides insurance or care for low-income individuals, children, the elderly, disabled people, and disproportionately, it provides funding for rural and small-town medical facilities and hospitals. So cutting this funding is going to lead to exorbitant strain on hospitals because they're not going to be getting paid back for their services. It will increase medical bankruptcies. It will lead to hospitals then passing the costs that are not getting recovered from the people who can't pay onto the people who can pay in the form of higher insurance premiums and higher costs. And we're going to see decreased health outcomes from it. And then also we've seen that they are cutting veterans care, so that is further going to strain our healthcare system. So let's talk about the impact that it'll have on the young. So children to young adults, age 0 to 18, over half of all children currently get their health care or their health coverage through Medicaid, about 40 million kids, or the CHIP, Children's Health Insurance Program. So any cuts that reduce funding to these essential services is going to include cuts to their preventive care. So they may not be getting vaccines, checkups, dental care, and vision care. They won't get treatment for chronic conditions such as asthma and diabetes. And you're also going to see decreases in NICU and pediatric hospital services. Children with disabilities are going to be at extreme risk because Medicaid funds all of the early intervention and special education programs for many of those children. So you're going to see increased infant mortality. You're going to see increased prevalence of preventable disease like your measles outbreak in Texas right now. You'll see more absenteeism from school, and you will see more prevalence of long-term developmental issues because we aren't going to be having interventions in early childhood. Then let's talk about your working adults, age 19 to 64 years, especially the low income or the disabled. So you have millions of adults who rely on Medicaid because they have low wage jobs or jobs that don't provide health insurance, or maybe they work part-time where they don't get health insurance. You have disabled individuals. There are over 10 million disabled individuals who are on Medicaid. They are going to lose access to critical health care, especially those individuals who require long-term facility care. Medicaid pays for all of that. And then your rural working Americans are going to be hit the hardest because Medicaid, even if they are not on Medicaid, Medicaid funds prop up rural and small town hospitals. So those will be the first hospitals that will close, and those rural working adults will have to drive farther or longer or take more days or more time off work in order to actually go get medical care, which means they aren't going to go get medical care unless it's really urgent. So you're going to have underlying diseases that go undetected for longer periods of time, which mean they'll be more catastrophic when they finally catch that they have something going on, and it will be more costly, and they will lose more productivity out of their work life. And then you have the Medicaid expansion under the Affordable Care Act. That covers up to 15 million working adults, and they will lose completely their health care. They will completely lose access to their health care, which means they will go back to the way it was before when they waited until they were really sick and they went to the emergency room for their health care, which then leads to higher costs. It leads to hospital bankruptcies. It leads to medical debt bankruptcies, which is a huge drain on the economy. It's also going to lead to poorer health outcomes in your workforce, which means more missed days off work, less productivity for employers and the economy. And then you have your older adults who are your 65 years plus. So these are your retired adults. And so the most impact is going to be felt in your nursing home and your home care, because Medicaid funds about 60% of all nursing home care. Medicare really doesn't cover that adequately, so they rely on Medicaid to cover nursing home care and in-home care. So if we have cuts to Medicaid, what would happen then is those Medicaid dollars that are used to pay for people's long-term care, that money actually props up nursing homes and keeps them open because it funds them. So it's going to lead to nursing home closures, and it's going to lead to higher costs for families where, you may have to private pay to put grandma in a memory care facility, or you may have to bring her home and somebody might have to quit their job to stay home and take care of her and make sure she doesn't disappear out your door and vanish. You also will have more seniors who will be forced into hospitals because hospitals are covered by Medicare. So if they can't afford home care and Medicaid is gone to where they can't get long-term care, they're going to stay at home until they're too sick, and then they're going to get admitted to the hospital, which once again is going to increase your medical costs across the whole system, which is going to lead to bankruptcies for individuals. It's going to lead to hospitals that are not being paid for their services, which could lead to bankrupt hospitals or hospitals closing. But regardless of hospitals closing, it's going to lead to higher costs for people who can pay and higher costs for insurance companies, which is then going to lead to higher insurance premium costs for those who have insurance, which means employers who provide insurance as an employment benefit are going to have higher benefit costs. And this is also going to increase a strain on hospitals as they see more and more patients coming to them who could be treated at a lower level of disease, but they're not seeking treatment because they can't afford it or they don't have a place to get that care until their care needs are so urgent that a hospital will take them. Then you have to look at the rural versus urban aspect of this. So rural communities depend on Medicaid dollars much more than urban areas because of the higher poverty rates, and there are fewer employer-based insurance options in rural areas because you have more like agricultural employees or self-employed business owners or sole proprietors. Many hospitals rely at a very high level on Medicaid reimbursements. So if Medicaid funding is cut, these hospitals will close. We have already seen since 2010, 150 plus hospitals across the country in rural areas have closed due to financial issues. Urban areas would see larger crowds in the emergency room as more uninsured people wait until they're very sick to seek care, at which time they will seek care in the emergency room. So what you're going to see is you're going to see higher mortality rates in rural areas as people either don't have access to care or would have to take more time off work, travel farther to get care, so they will delay getting care until they're very ill, which means they may not be treatable at that point. So they may end up dying. Then you'll see on the healthcare system in general, we've kind of already touched on this, but you'll see Medicaid reimbursements, if they are being stopped, medical reimbursements to hospitals for low income and uninsured patients, you're going to see rural and inner city hospitals are going to face financial collapse. Community health centers, free clinics, and safety net hospitals are going to struggle to stay open. Your free healthcare community centers are going to be overrun with people to where they may not be able to operate or they may not be able to see everybody. And then once again, hospitals and clinics, you're going to see more people flooding to the emergency room, which is going to drive up the percentage of uncompensated care hospitals and emergency rooms provide, which is going to put a financial strain on them. But also with the more people seeking care in the emergency room, it's going to delay treatment for all patients. Then you have hospitals in states that expanded Medicaid. They're going to be hit the hardest because, for example, Louisiana, after it expanded Medicaid, the charity care cases that they saw in their hospitals dropped by 55%, which means cases the hospital had to write off for non-pay dropped by 55%. So Medicaid, because the Affordable Care Act was expanded via Medicaid, those hospitals were now getting paid for those services instead of taking it as a loss. So if we defund Medicaid, that would reverse that, and these hospitals are once again being pushed into financial crisis. You also will see doctors and healthcare providers exiting the workforce. So you have a lot of doctors, nurses, home health aides, different medical businesses, medical providers, that they rely on Medicaid reimbursements to stay open. And so if you have fewer Medicaid dollars or if you cut Medicaid funding, You will see providers just say, you know what, we're not going to take low income, we're not going to take Medicaid, we're not going to take any of, these patients, which then you're going to see longer wait times for care at the places that will take those patients. Because of all of the cuts and the loss of revenue that these hospitals are going to face, you're going to see staff reductions at hospitals and medical providers, which means not only are you going to have longer wait times to be seen, but you're going to have the providers who still are working. They are going to be working longer hours, having fewer days off, and you're going to start seeing burnout and an exodus from the medical employment and staff shortages. And then you'll also see nursing home worker layoffs because Medicaid disproportionately funds nursing homes. So if you lose Medicaid funding for nursing homes, they will not be able to afford to pay their staff. So they will have to cut their staff, which then means reduced care for your seniors and your individuals who are in long-term care, younger disabled people who need full-time care. Then let's talk about veterans. So veterans health care benefits, some of them also are on Medicaid. So there's about 10% of veterans, not only do they get service through the Veterans Administration or benefits through their veterans benefits, but they also rely on Medicaid because they're also in a low wage job or in a job where the employer doesn't provide insurance. So cuts to Medicaid, especially since we're already seeing cuts to the VA, we are going to see an increase in homeless veterans and reduced health in veterans, especially in the low income and part-time employed veteran population. Veterans with disabilities are going to be particularly vulnerable because they're going to lose access to home-based and community-based care, PTSD treatment, and they also will lose access to prosthetic services. A lot of that's covered by Medicaid and then the VA. So if you have already cuts to the VA plus then cuts to Medicaid, you're going to have a significant impact on your disabled veterans. And then mental health and suicide prevention efforts are going to be severely weakened. Socioeconomic effects. So this is going to be the ripple effect through the economy. If you cut Medicaid, you're going to have a higher rate of uninsured people, which means you're going to have an increased number of medical bankruptcies. Millions of people will lose coverage, which means they're going to have increasing medical debt. And right now, medical bills are already the number one cause of bankruptcy in the United States. You're going to see financial ruin for a much greater number of people. And that's going to ripple to the medical providers and hospitals that aren't getting paid, where they may not be able to stay open. Uninsured people added to the medical system are going to delay care for everybody because they are going to wait longer to seek care, which means they're going to need more intensive care and they're going to need more expensive treatments, and they're going to wait long enough where they're going to be going to the ER and clogging up the ER. So that is going to worsen health outcomes, and it's going to higher costs over the long term for everybody. You're also going to see job losses in the healthcare sector. So that is going to hurt rural economies where healthcare is often the largest employer. So if you think of a hospital in a small town or out in a rural area, they typically employ a lot of people. So that is a large economic driver for those small town and rural communities. You'll have increased poverty and worsening public health. So you'll have more untreated illness in, across the nation and in every community. You'll have mental health issues that are going unaddressed, and also you'll lose access to substance abuse treatment. So you're going to have increased poverty and worsening public health because there's going to be more untreated illness. There's going to be a lack of services to address mental health issues, to help people with mental health issues. And you're also going to lose substance abuse programs to help people with substance abuse problems. You will see higher infant mortality rates, and you also will see increasing maternal mortality rates and worsening maternal health outcomes. Bottom line is, cuts to Medicaid are going to worsen social inequality. They are going to disproportionately harm vulnerable or marginalized populations, and that means the poor, the elderly, the chronically ill, your veterans, and your rural communities. They're going to be disproportionately harmed. To summarize, children, you're going to see increased infant mortality, fewer vaccines, and a greater school absenteeism. For working adults, you're going to see a higher number of emergency room visits, more disability, and a worsening workforce health. In the elderly, you're going to see a loss of nursing home care, nursing home closures, a loss of in-home care. And in rural America, you're going to see fewer doctors and hospital closures, and also hits to the economy when they lose those medical provider employers. Insurance and healthcare providers, you're going to see job losses, longer wait times, overcrowding in the emergency room. And in the veteran community, you're going to see more homelessness, untreated PTSD, and lack of access to prosthetics. And then overall in the economy, you're going to see increased poverty, you're going to see increased medical bankruptcy, you're going to see job losses, and you're going to see, people in the able-bodied working age designation become disabled or die and not be in the workforce anymore. So you're going to lose members of the workforce. Cutting Medicaid by $880 billion is going to harm millions of Americans. It will destabilize the healthcare system, and it's going to deepen economic inequality. So combining this with the cuts that we've already seen in veterans benefits, it will create a public health and economic disaster.